The discussion of today is about TB and HIV, that is tuberculosis and human immunodeficiency virus. So I want to do a health education on TB and HIV. What is tuberculosis, that is TB? It is a disease caused by a bacteria which is transmitted through the air. And I want to tell you that from an infected patient's cough, mucus, or saliva, one can get tuberculosis. It is not sexually transmitted, hereditary, or caused by witchcraft or breaking taboos. Tuberculosis is a treatable disease. And what is HIV? This is a condition caused by a virus which is transmitted most commonly through sexual intercourse. It can also be passed from mother to child through the sharing of contaminated needles or laser blades and through the direct contact of infected blood or other body fluids. Interactions between tuberculosis and HIV, and how can I prevent myself from getting TB? Ensure you live in a well-ventilated environment, practicing good hygiene, like covering your mouth and nose when you cough or sneeze. How does being HIV positive affect TB? A person living with HIV is more likely to catch TB. Increased risk of recurrence of the disease, increased risk of experiencing side effects from the TB medication. And how does TB affect a person living with HIV? TB is the most common opportunistic infection given the weakened immune system and quickens the progression from HIV to AIDS. TB is the most common cause of death in PLHIV because of its effect on the immune system. Please note, I have negative person can get TB. Please note, a HIV negative person can get TB. What are the common symptoms of TB? We have coughing for any duration. We have excess sweating at night. We have unexplained weight loss, chest pain, general weakness and fatigue, fever, reduced playfulness in children. How is TB tested? TB in the lung can be discovered using either the sputum or urine test. TB affecting other parts of the body, such as skin or spinal cord, requires specialized tests. TB treatment is usually a mixture of more than one antibiotic. Treatment for TB is a process that requires you finish all your medication. If not, the bacteria will still remain in your body, leading to a recurrence of symptoms, passing the bacteria to other or developing multi-drug resistant TB. The side effects listed below tend to subside within 3 weeks and do not usually require a change in medication. If symptoms persist, please check medical advice or speak to your treatment supporter. Possible side effects of TB medication. We have common TB drug names, and I'm going to tell you, and possible side effects. We have a certain drug called rifampicin. Rifampicin is given to the side effects like when you have nausea, vomiting, color change of urine, sweat, and other body fluids. We have another medicine called isoniazid. Isoniazid, this is given when you have a side effect of numbness of the hands and feet. Ethambutol, this is when you have night blindness and joint pains. And then we have another medicine called pyrazinamide. This is given when you have nausea, vomiting, and joint pains. These are some of the key information about TB and HIV. TB, which is tuberculosis, and HIV. Tuberculosis is a disease caused by germs that mostly affect the lung but can also affect any other part of the body except the ear, teeth, and nails. Again, TB can affect anyone, young, old, men, women, the rich, and the poor, and is curable. TB is spread through droplets in the air from an infected person who has TB disease when she or he coughs, laughs, sneezes, sings, or spits openly, and a healthy person breathes in the germs. While HIV, this is a condition caused by a virus which is transmitted most commonly through sexual intercourse, and HIV can also be passed through mother to child through sharing of contaminated needles or laser blades, and through the direct contact of infected blood or other body fluids. You can prevent TB by not sharing an enclosed space of room with a TB infected person, not smoking or consuming alcohol, not living and working in a dark or poorly ventilated rooms and overcrowded places, minimizing interactions with people who have moved in or out of the areas where high TB disease such as refugee camps, mines, and alcohol dens. Eating a balanced diet and exercising. By protecting the very young and elderly people from exposure to TB, proper management of chronic illnesses such as diabetes and hypertension, routine screening of TB among people living with HIV. That's how you can prevent TB. So what you're supposed to note is TB cannot be transmitted by shaking hands, sharing utensils, touching bleeding, or sharing a toilet with an infected person. The following people who have a greater chance of developing TB are a person sharing an enclosed space or room with a TB infected person, people living and working in dark and poorly ventilated house, and people living and working in overcrowded places. So that is those are some of the chances for one to get TB. And let me give you more because this one is very important. People who have moved in or out of areas where high TB disease such as prison, refugees camp, we have gold mines and alcohol dens, those are people that they might be having TB. People with malnutrition problems, people who don't take a balanced diet, young and elderly people because of low immunity, people who are young and the old, their immunity is very low, so for them to get TB is very easy. People with chronic illnesses like diabetes, hypertension, and others, and people living with HIV. It is very important that all the people, that is adults and children, you live with or regularly interact with at home or at your workplace, visit the nearest health facility to be screened for TB. Tuberculosis, that is TB diagnosis. How do we diagnose for TB? How does a person get diagnosed with TB? TB diagnosis is done by screening and testing those with TB symptoms. How do I get screened for TB? You will be asked questions to find out if you have any of the following TB signs and symptoms. TB symptoms in adults: cough of any duration, fever, that is hotness of the body, sweating at night, and loss of weight. TB symptoms in children: we have cough, reduced playfulness, fever, that is hotness of the body, night sweat in older children, poor weight gain or weight loss, general body weakness, irritability, excessive crying, previous interaction or contact to TB patient. Those are the TB symptoms in children and in adults. If you have any of these symptoms that I have said, please visit a health facility for TB testing. How do I get tested for TB? A number of tests are available for testing if the health facility. And this number of testing in the health facility, they include laboratory test on sputum or other body tissues and X-ray. It is possible for a person to have TB with TB test are negative. So your TB test may be negative, but you have TB. Yes, in some instances, a person can have TB yet TB tests are negative. In case you are found to have TB, what next? Your doctor will prescribe the appropriate TB medications. You should take your medication at the right time, regularly, and as advised by your doctor. Do not stop taking your TB treatment even if you feel better until you complete your treatment plan, which ends at 6 months or 9 months. That is in case you find you have TB. That's what you're supposed to do. We continue. Sorry. Remember to collect your TB medication weekly for the first 2 months of treatment. And then every 2 weeks for the remaining period of treatment, unless advised otherwise by the doctor. Another thing is inform your doctor if you are on your other medications. This will assist your doctor in advising you on taking the medication appropriately. If you are on hormonal family planning method, discuss with your doctor on how to add a barrier method, e.g. use of condoms. You will be given your TB medication based on your weight. Ask your doctor about joining TB patient support group if available at your nearest health facility for additional support. Ensure that your close family or friend you interact with are screened for TB. Those found to have no TB will be given TB preventive medicine. Avoid alcohol, herbal medicines, hard drugs, and smoking while on TB treatment. If you are living with HIV and have TB disease, talk to your doctor about TB preventive medication once you finish your TB medication. And what is TB treatment journey like? That is now our question. The duration of TB treatment is 6 months except the treatment of TB in the brain, the bones, and joints, which takes a period of 1 year, that is 12 months. Drug-resistant TB treatment takes 18 to 20 months. Another thing is, take preventive measures, cover your mouth while coughing, open windows, stay outdoors where possible, and avoid spitting on the floor during the treatment period. Follow-up sputum to be done in the end of 2nd, 5th, and 6th month or as advised by your doctor. This is done to monitor response to treatment. So your treatment journey, that is, take your TB medication every day at the same time as advised by your doctor. Have your weight checked monthly. Look out for any side effect. So what we are supposed to know here is you have been tested and you have TB. So day 1, in month 1, that is day 1 in the month 1, start on TB treatment. Always cover your mouth with tissue or cloth whenever you cough or sneeze. End of month 2 of your TB treatment, do a sputum test. Month 3 to 4, continue with your TB treatment. End of month 5 of your TB treatment, do another sputum test to confirm progress. End of month 6 of your TB treatment, do another sputum test to confirm you are cured of TB. End of month 6 of your TB treatment, do another sputum test to confirm you are cured for TB. And hurry if your sputum test is negative, congratulations. So that is if your sputum test is negative, congratulations, that is at 6 months. The duration of TB treatment is 6 months, except the treatment for TB that is in the brain, the bones, and the joints, which takes a period of 1 year, that is 12 months. Your TB treatment journey support. Identify and inform a treatment supporter, that is family or a friend, who can remind you when to swallow TB medicines. Follow treatment appointments and social support. Another thing, it is important that the people, that is adults and children, you live with or regularly interact with at home or workplace are asked if they have TB symptoms. This will help with timely treatment to those found to have TB. It is your responsibility to talk to them and ensure they see a healthcare worker at the nearest health facility. Take healthy diets to promote healing. 3 meals, 2 healthy snacks, and plenty of water. Take a lot of water. So when I say that take healthy diet to promote healing, I mean like you take 3 meals a day, and then you have snacks in that day, like in between the day you have 2 healthy snacks, and then you take a lot of water, that is fluids. Another thing, micronutrient supplementation is recommended for all eligible patients. Avoid alcohol, herbal medicines, hard drugs, and smoking while on TB treatment. Do not stop taking your TB treatment even if you feel better until you complete your treatment plan as advised by the doctor. Do not share your TB medication with anyone else because this will reduce the correct amount you require to quickly recover from that TB. What to look out for when you are on TB treatment? Should you experience color change in urine or feel like vomiting, do not worry. Just continue with your TB treatment. Should you experience shortness of breath, skin rashes and itching, yellow color in your eyes, feeling of burning or picking on fingers, palm of your hand, sole of your foot and toes, inform your doctor immediately. Frequently asked questions about tuberculosis. Now that I have TB, does it mean I have HIV? Not necessarily. That is now the answer for that question. Not necessarily. You can have TB without HIV. You can have HIV without TB. And it is also possible to have both disease at the same time. The only way to know about your HIV status is through testing. Once I am treated and cured for TB, can I get infected with TB again? That's another question that was asked frequently. Yes. So the question was like this. Once I am treated and cured for TB, can I get infected with TB again? The answer is yes. If you are exposed to a person with infectious TB, it is possible for you to get infected with TB again. Another question: if I have TB, does it mean that I also have HIV? No. The germ that causes TB is different from the one causing HIV. However, having HIV increases the chance of you developing TB. What should I do when I miss a dose of TB medicine? Take the missed dose immediately you remember and then report the number of missed doses to your doctor. Is it safe to take TB treatment during pregnancy or when breastfeeding? Yes. TB treatment does not interfere with pregnancy or breastfeeding. However, always inform the healthcare provider if you get pregnant or are breastfeeding for support and guidance. What can happen if I feel I fail to complete my treatment? That's a question. Number one, you may develop drug-resistant TB, which is more difficult and expensive to treat. Number two, the treatment could fail and you become more sick. Number three, you may continue to infect more people. Number four, you may be forcibly confirmed in a hospital until you complete treatment. And number five, death might be the end result. Another question that was asked here: am I able to continue with my usual work activity when I am on TB treatment? Yes. However, the body may need rest in the first 2 weeks, which will require you to avoid your usual work activities. And then, can I get TB after I receive vaccination, that is BCG? Yes, you can. Yes, you can, because BCG vaccine only protects you from severe TB disease. So here I have some myths about TB and facts. So first myth is TB is genetic. No, TB is transmitted through the air. In a household, TB can be spread from one person to another in the same household. Another myth: TB is as a result of witchcraft. The fact is no. TB is an infectious bacteria airborne disease. Another myth: TB was eradicated in Kenya. That TB was eradicated like it is not there in Kenya. The fact is no. Kenya is still among the high TB burden countries. Another myth about TB: some foods can be used to treat TB, e.g. donkey milk. Fact is no. Only TB medicine provided at health facility can treat TB. Another myth: TB affects smokers only. The fact is TB can affect anyone, but people who smoke are at a greater risk. So what you're supposed to remember is TB cannot be spread by shaking hands, sharing utensils, touching bedding, or sharing a toilet with an infected person. And for HIV, cannot be spread through touching, sharing utensils, kissing, insect bites, and toilet seats. So that's all about TB and HIV patient information. I really want to appreciate you for your time, and if you have not subscribed to my YouTube channel, please ensure that you subscribe. And if you have subscribed and you are a returning viewer, thank you and be blessed a lot. I'm going to do a lot of these health educations. I need to prevent these diseases from getting to the community and making people to be sick now and then. So prevention is better than cure. Thank you. Bye bye. See you next.